amount of stress. So in our profession, the stress is there always in every specialty. I'm asking because the people should know before coming. I mean, choosing the field of cardiology, like depending upon the scenario, like whether corporate setup or in nursing setup. In case they are choosing interventional cardiology, then they have to handle all the acute emergencies mostly because that is like time bound activity they have to do. Like so, in that way, how the amount of stress? Can you give your view on that?
It's a bit stressful because you are working on a beating heart, and at the same time you have to like convince a lot of people. It's not like a CA. Some CA patient comes, they know that okay, CA, though a lot of treatments are available, people accept. But all of a sudden, somebody comes in heart attack, you tell them and you explain to them and you treat them. Majority of times you may be successful, many of the times you may not be. So you should also know how to handle those situations, and that's more important. Always see, anything can happen to anybody at any point of time. As far as intervention is concerned, you should know how to handle that first. And if you are doing it all over a period of time, we cannot learn everything in that stipulated 3 years of time, and it's all over a period of time everybody learns. And stress means like it all depends what sort of it depends on the case or your administration or your own problem, and how in spite of that how you help the patient to come out of that crisis situation. That matters. And see, definitely if when you do cases, more number of cases are waiting in the line, and then you are taking more and more amount of time, then everybody around you will become tense. But you only know how to finish that procedure, and it all depends. And definitely stress is there. I don't say that it's not a stressful job. And see, nowadays if you have helping hands after certain point of time, you should know when I have to shout for help. And if you shout it, then somebody comes and chip in and help you out, then definitely the stress will be lesser. So at the end of the day, you also happy, the patient is also happy, and your stress is also less. Unless then you are working on the same thing again and again, your mind after a period of time will not think in a different way, that too in a critical situation. When you have a helping hand, it's easier to ease out the stress. It all depends. If you want work more, then you have to take stress more. If you want to work less, you can stress yourself less. This is about stress of this specialty. But at the end of the day, when the patient is going home with a smile in their face, that gives rewards to you. From acute crisis, if you do something and everything went well.
I think there is a phrase that like generally currently that trend is like, that is a phrase, even though that gives happiness, but that actually in that sense we should not injure ourselves, harm ourselves, because nowadays the amount of doctors doing is like more in they are doing like they're pushing themselves and they're working more, and we cannot say they'll just sake of like seeing smile in other face, like
so this is definitely I agree totally. See, it at any point of time can take a U-turn and it can bombard you. And see, at the end of the day, if you do some procedure, it's not like always I am telling. Midnight, 1 o'clock, you are going do some procedure, it works and goes well, and see, if you like whatever you were thinking, it goes well, then you are happy. If it's not going on what you were thinking, once again you have to what went wrong, you have to analyze yourself, that what step which went wrong, then you have to change that step. This is how at emergencies we improvise our skill and need not go at 1 a.m. It can happen at any time. And see, whatever we are not injuring ourselves also, but at the same time, whatever you do with some satisfaction. That should be there.